Hey, this is Dr. Johnson. I promised another video and I said I would relate herd immunity to football. So I put on my jersey for y'all and I am ready to go. So probably y'all have been hearing a lot about herd immunity or herd threshold, which is how I like to look at it, to see like when are we going to end the pandemic, right? Everybody wants to know when it's going to end. And some numbers have been kicked around as to how many people have to have natural immunity, meaning you got sick and you developed antibodies or protection from future infection, or how many people have to be vaccinated in order to reach protection for the majority of the population, so that as new people are born or people who can't be immunized won't get sick, or as immunity wanes, maybe they won't get sick. And people have been kicking around the number about 70%. This is not a known entity, it's an estimated entity, but we think about 70% of the population will need to be immune, whether it's through natural infection or whether it's through vaccination, in order for us to have some protection from frequent outbreaks of the disease that are currently causing our pandemic, okay? And that's what we want to get away from, right? We want to get away from our pandemic. Now, this number relates to something called the R naught, and somebody may have talked to you about this before. You might have seen it in an article, but it's basically, you know, I'm one person, I get sick, how many other people can I get sick and spread my germs to? And this is a moving number, the R naught. It's not something that's set and stays that way. There are things that we can do to change our R naught. We've already started to do those things, like masking and social distancing. And then actually the R naught can change based on how much immunity develops in our population. So we're gonna be talking about some of these things. I wanted to tell y'all a little bit about a GIF on Facebook, and it's really cute. You can look it up if you want. If you just put in herd immunity, it'll show up, and it shows this little stick figure, and he's surrounded by other little stick figures, and he coughs and spews his germs that you can see outside of his body, and all the other stick figures hurry up and like tuck down and lift up a shield and put it in front of themselves, and they kind of tuck and move away, and you see that that shield repels those germs. And kind of off in the distance, there's another stick figure without a shield, and that person is happy and fine and doesn't get affected by the germs that were spewed. And that really, I don't have those kind of graphics, I'm not that kind of artist, but it's a really great description of how herd immunity can work for preventing spread of infection. And we know it works, right? When was the last time you saw smallpox? It works. So I wanted to talk a little bit about the US population. So we're about 330 million people in the United States. And so far with COVID, natural infection, meaning you got sick, or you had asymptomatic infection, maybe you didn't get sick, but you got it. There's about 25 million people who have had COVID at this point in time. This is an approximation. I broke down this time the doses of vaccine into how many people who have gotten 2 doses, and we're gonna get to why I broke that down. And that's 3.2 million people. And the number of people who got 1 dose of vaccine, which is about 20.1 million people. So, you know, if we look at this from how many have been what we call completely vaccinated, so they have 95% efficacy in protecting themselves from the virus, that is really not very many people in the US population so far, right? And if we look at, you know, how many people have gotten the first dose, which gives us about like 50% efficacy, you know, maybe our numbers look a little bit better for what we've been able to achieve. But I think it becomes quite clear that we're in the middle of a pandemic and we have a new vaccine which is being produced, and it's not very easy for, you know, the company to produce just millions and millions of doses of vaccine. So the likelihood that we're going to reach the end, like people are asking for the pandemic, is not going to be like turning a light switch on and off. I wish it would, but it's not going to be like that. It's going to be more like a ramping down. Just like back in April when we were all locked down and people were asking like, why are we locked down? Do you even know anybody who has COVID? But then when we weren't locked down anymore, we saw how the cases ramped up. Well, as we see natural infections continue to occur, because it's really hard for us to prevent them right now, and as we see vaccine immunity ramp up, this will ramp down. But 2021 is not going to be turning off the light switch of the pandemic. And I've seen people say like, well, if we have a vaccine, why do we still have to wear a mask? And I get that. But I want us to also be critical thinkers about this. And so it's really going to be a slow ramping down. I wish it was a light switch, but it's not. And this really demonstrates that. The other thing that I've seen that I want to just hit on is that I've seen people say, well, so-and-so got the vaccine, the first dose, and they were like sick the next day and tested positive for COVID. This is not from the vaccine. There is COVID actively going on in your community. And some of you who are getting vaccine right now work in high-risk occupations. So if the vaccine hasn't even had time to get into your body and build up antibody, which remember, best antibody is 7 days after the second dose. I covered that in one of my prior videos. Then just one dose 24 hours before is not going to prevent you from becoming ill from COVID. Okay, but your COVID is also not because you got the vaccine. And so even in between doses, or even within 7 days after that second dose, I mean, you're still at risk. And remember, it's 95% efficacious, so it's not 100% efficacious. Even after we reach a certain amount of immunity within ourselves, there are going to be some people who might still be at risk. Okay, I wish for perfect, but it's not going to be perfect right now. So I said I was going to relate it to football, and I am going to, and we're going to start with the injured reserve. So right now, our injured reserve are the elderly, people with significant obesity, if you have hypertension and chronic disease like lung disease, kidney, or neurologic diseases, you're kind of our people we're trying to protect, right? You're most at risk when you get sick. And so really we want you hanging out on the sidelines. We don't want you getting injured in the game. And so we would like to get to a point where even with herd immunity, if there are people who can't get vaccine or they maybe are too young, that we're protecting them. So you're our injured reserve, but maybe we're protecting you from any kind of injury. So I wanted to start with that. And just keep these people in your mind. Hopefully with vaccine, we're starting to protect some of those people. So one of the things I've heard a lot about is, well, I don't want to get the vaccine. I'd rather us just let all of the illness happen and all of us get natural immunity, and it's either or. This isn't an either or situation. The truth of the matter is we're probably going to have ongoing natural infection in people who are susceptible, who can still get sick and haven't had it, while we're also trying to actively protect people by immunization and building up in a very natural way their own antibodies. It's not a competition between the two. It's not. It's actually going to be more like a team sport where we use both. And we likely are going to need both to come to some end to our pandemic. We may still have small outbreaks in places or like little epidemics, but we'll see decreased infection rate. And maybe over time, if we realize that it's going to take both of these things, we will ramp down and get to that point that everybody is really hoping for, which is the end of the pandemic. If we choose only natural immunity, there are penalties, just like in a football game, for natural immunity. Not everybody's going to get a penalty if they break the rules, right? The referee may not see it. You might not have a problem. You might get infection. You might not get that sick, right? You might lose your sense of smell and it takes 6 months to get it back, but you do get it back. But there are some people who might have significant penalties they get infection and they have an issue. The biggest penalty for us right now in healthcare is the effect that this is having on our health system, hospitals, emergency rooms, ICUs, nursing staff, critical care physicians, anesthesiologists. I mean, I could go on and on, respiratory therapists. They are being overwhelmed. And so they're paying the price right now for us, and that's the penalty of this natural infection. But some people are dying. That's the ultimate penalty. There are other people who get blood clots in their legs or in their lungs. They have serious illness. They're going home on medicines to try and prevent clotting. There's injury to the lungs for some people. There's heart inflammation or myocarditis. Even young people, athletes, have been found to have this in a certain percentage of people, a higher percentage than we would like in a small study out of Ohio State. And then there are the people who are called the COVID long haulers. We really don't entirely understand this yet, but there are people who got infection, didn't have to go in the hospital. It didn't have to do with how severe it was, but they suffer from just intense fatigue. They're having other problems with muscle aches or brain fog, where they feel like they can't quite think clearly, and it's happening for a long time. They still feel short of breath, even though their chest CT scan and x-rays look fine. So there's some unknown here that we don't entirely understand that is a penalty of natural infection. We don't really see these penalties with active immunization, which is what vaccination is. So right now, we're playing a football game, and we are in very bad field position and 28 points behind Alabama, okay? And the University of Alabama is rolling tide all over our U.S. population, okay? Not a real good position to be in, right? I mean, I think for many of us, we all know that you can bet on Alabama being a really incredible adversary. And that's where we are with SARS-CoV-2 or COVID-19 right now. We're in bad field position. And so what do we need to do, about it? So let's imagine like this is where we are, right? I'm sick and I'm a punt returner, right? And I want to return that football, but there are all these people on defense, like 10, let's say one player is not out there doing their job on the punt return, but they're coming at me and I don't have a lot of defenses for them. And so I'm really trying to run something back that I may not be able to do and compete with. So, certainly sometimes defenses win a football game, but usually by themselves they don't, all right? And our best defense is a good offense. And so, early on last year, and even now, while people are still not able to get vaccinated, the best thing they can do is spring training, right? They can maintain hydration, drink lots of water, make sure they're not drinking too much alcohol. They can maintain or work on their body mass index, if they are overweight, trying to get within a normal rate, since we know that obesity is a problem for some people if they're sick. They can try to maintain normal levels of vitamin D and zinc, because we know those play a role in our immune response and our ability to fight infection. They can maintain good control of their chronic diseases like asthma. So if you are on an inhaled steroid, a preventive medicine to prevent cough from asthma, you want to make sure you're doing that religiously every day to keep good control of your asthma. If you have diabetes, you want to keep your sugars under good, tight control so that you're not putting yourself at risk. If your sugars are high, your immune system will not work as well. And then hypertension, making sure that you're getting your blood pressure monitored and you're taking your medications for hypertension. So kind of for a long time, this is what we had. We had spring training, okay, to play our football game against Alabama. And we were doing the best that we could. Now when we play football, we wear protective gear. And many of us couldn't imagine like putting our teenager out in a football game without a helmet, right? And so that's what we're doing right now is for help in our offense, we're wearing our protective gear. And so if you could imagine, a helmet is like our mask. We wouldn't throw a football player out there without wearing a helmet because they could get a concussion or they could get a spinal injury or other problems, facial injury. We're just not going to do that. So we're going to protect them with that helmet, just like we're protecting ourselves with a mask. It's not our only form of protection. So, sometimes we put pads on, so we're using our hand gel to wash our hands, just like we would put pads on to protect our body. And we're going to try and stay 6 feet apart. Okay. Now, I kind of consider this like an offside penalty. If you come too close, then you're offsides and you're putting me at risk. And so we don't want to do that. We don't want to be offsides. We want to try and maintain our distance as much as we can. In football we have special teams. I like to think of, when somebody's going for a field goal and there's, that defensive player who really jumps up and tries to stretch and bat the football back down so they can't get a field goal. Sometimes he's successful. It's not super common. It's not often that just special teams, has an effect where they win a game, but it does sometimes happen. And we do have our own special teams now. When we started in the pandemic, we really didn't know how to use these players, but now we do. And that includes things like monoclonal antibodies. These are medications that, can bind to the virus. There's even one now for people who have mild to moderate disease and these injured reserve risk factors, and it can be given as an outpatient infusion. Decadron, which is a steroid, not for the outpatient setting, but for hospitalized patients who get significantly ill, it can have an effect. And so Decadron is another one of our special teams. I'm sure people have heard of remdesivir. It's an antiviral medication which has shown to be helpful. And then these are tried and true. So mechanical ventilation, having a tube down your throat to help you breathe until your lungs get better. And then even ECMO, which is basically kind of like cardiopulmonary bypass or cardiac lung bypass. So if your heart and lungs can't do the job, it does it for you until they get better. Well, these are all great, and we want them, but basically we're still behind, right, in our game. We're still playing Alabama, and we're doing everything that we can to get better, but it's just not enough, right? It's not enough to fight off the 28-point lead that they have. We're still in really bad field position. So what we're trying to do right now in medicine and in the pandemic is work on our offensive measures. We're trying to build a better offense. So like in a war, your best defense is a good offense, or in football, because I really prefer to talk about football. And so we want to use this to help build up our herd threshold or our herd immunity. Now, a lot of times people talk about actual herds like wildebeest and things like that. And that, in a big group of wildebeest, you can protect yourself from the crocodile. But not many of us hang out with a lot of herds that are in that situation. But I think we do understand football. And there's things that we can do on our offense to improve our situation. And honestly, vaccination is a good offense right now. Okay, we're not going to be able to prevent the other team from scoring. We're still going to have natural infection that is occurring, but if we can try and prevent that in more and more people, that's our goal. And so we want to learn proper tackling technique, and we want to study the game video of the opposing team. And if you watch my first video, I talked about T cells and B cells and how mRNA makes the spike protein. That's what we're doing there. We're studying the game video. We're recognizing what the spike protein looks like so that when we get out on the field, if we know the plays that the other team is going to try, we can prevent them from executing those plays and beating us and scoring points, right? So that's what we want to do right now. We want to keep with that vaccination, making the spike protein so our body is studying the game video, okay? And, the proper tackling technique, I like to think of those T cells that are binding, to the virus when it comes across it and recognizes the spike protein and flags over the rest of the team like, hey, come get this guy and kill him. We might also work on the throwing arm or the strengthening of our quarterback in our offense. And I like to think of that as like our antibodies and our B cells, our memory. We're muscle memory. I remember this. If it shows up again, I'm going to be able to complete this pass. And that's what we're doing through this very natural use of our immune system. And the ultimate thing that we want to do is we want to have viral team defeat, right? I mean, we want to defeat, if we're saying that Alabama is our competitor, but really it's COVID-19, not Alabama. We want to be able to defeat it. And so having a good offense is part of the way we're going to do that. So I just want to talk about a couple other things that have come up real briefly. Don't really have a lot to do with herd immunity, but I hope y'all understand how, it's not an either or competition. We're going to still have people, unfortunately, getting sick and having natural infection while we're also ramping up vaccination to try and, which would be preferable so that people aren't getting all those terrible body penalties that we don't want them to. But I've had some questions in the interim, and there are a few that I want to just highlight. One is breastfeeding. I've had people ask about getting the vaccine while they're breastfeeding. The Breastfeeding Medicine Association or group and many others feel that there's no reason not to get the vaccine while you're breastfeeding. I'm in a group of physicians who, this is anecdotal, but they've talked about their experience getting the vaccine and breastfeeding. The majority of them said it was fine. They didn't notice anything. There were a few who said, well, I had fever as a side effect from the vaccine, and I was fatigued, and I had muscle aches, and I did notice a decrease in my supply for a couple days, but then it all came back and everything was fine. So just to note that, and I'll put on the YouTube video in the little edit box the link to the Breastfeeding Medicine Organization if you want to take a look at their statement. The other thing is I've had some people say that they knew others who got cellulitis from getting the vaccine. And I was really kind of disappointed to hear that they were placed on antibiotics because of redness at the vaccine site. It's important for everyone to understand that there is what we call delayed hypersensitivity for some people after receiving a vaccine. It can come as late as 7 or 8 days later. It can cause similar symptoms to cellulitis, not fever, but 7 or 8 days later you can have redness, warmth, and a little bit of swelling. We see this with other vaccines, and it can be pretty significant. Like, I've seen people from here to here have some redness. I've had this before with both Shingrix and with one dose 1 year. I got influenza and got it. But it goes away on its own. It doesn't need antibiotics, cool compresses, some ibuprofen for any discomfort. It's also not a reason to not get the vaccine going forward. Having some discomfort, redness, and warmth in your arm is not a reason to not get it in the future. And then the other thing that I think I felt like I should talk a little bit about is just to reiterate to people. I think it's in my second video that I talk about my own experience with the vaccine, and that I did as a side effect or effect, forget the side, have fever, have muscle aches, I had chills, I had a sore throat, I had a cough, I had all those things for about 18 hours after I received the vaccine. I did wait to take a leave, but this is a vaccine where you are going to see some side effects with the second dose, most likely. Now, there are people who haven't, and that's great for them, but it's going to happen. And so you just need to educate yourself about it, know that you may have some fatigue for 2 or 3 days after, and then you're going to be protected. This is part of the signs of your body doing its immune homework, and you're going to be okay. And I think the last thing is allergy. There are people who have had allergy to the vaccine that's very, what we call acute, or right after the event. It's like 11 in 1 million people, I hope I'm saying that correct, I'll make sure. And if you have a history of allergy, where you had to use an EpiPen, your face got swollen, things like that, you should wait for 30 minutes and be observed, okay? And if not, you're still waiting 15 minutes for an observation period when you get your vaccine. And there are people where you get your vaccine that will know what to do if you have a reaction, but 11 out of a million people, it's really, it's scary if that happens to you. I know I have anaphylaxis, I have an allergy, but I think the important thing that you need to realize is it's actually uncommon. So it doesn't always make the person with anaphylaxis feel good to talk about it, that it's uncommon, but that means that there were many other people who had no problem with the vaccine, okay? Anyway, healthysproutsandhousecalls@gmail.com. I appreciate the respectful conversations that people are having with me. I do still have people occasionally reaching out or sending emails. If y'all have other things you want me to talk about, I'm more than happy to do the footwork for it, in my time when I can. And I hope that you're talking to people who understand science, understand how vaccines work, because those are the people that you need to be talking to about making this decision to get vaccine and hopefully help us all reach that herd threshold or herd immunity. All right, guys, y'all stay safe.